Welcome to the Gypsy Nurse Spring 2023 Virtual Conference, sponsored by TravCon. Your road to TravCon 2023 begins here. The Gypsy Nurses Spring 2023 Virtual Conference will be providing you and thousands of other travel healthcare professionals with 5 educational sessions to help you spring into your travel nursing career. Whether you're new to travel healthcare or looking for ways to stay up to date with tips and trends, the Gypsy Nurse and TravCon have got you covered. Looking to take the Gypsy Nurse Virtual Conference to the next level? Join us in person in Las Vegas, September 17th through the 20th for the event of the year for travelers at TravCon 2023.
TravCon is amazing!
Yeah, he's right. TravCon is amazing. Let's be real. Where else can you go to be surrounded by people who really get you? That's rhetorical. This is the place to go.
My favorite thing about TravCon is meeting all the recruiters personally so I can get a real feel for how these companies actually are. So I love TravCon.
See? She loves it.
My favorite thing about TravCon is meeting not only the recruiters but other healthcare workers, because the travel industry is kind of small. It's not big and out there. A lot of people don't know about traveling.
TravCon is the place to go to learn about travel. We have a Newbie BootCamp that walks you through how to successfully become a traveling healthcare worker. Don't worry though, we have a lot of classes for veteran travelers too. You can even get your CEs here.
So I really like meeting and networking of nurses, like I said, recruiters, there's credentialers here, there's a bunch, of people here, and then meeting the allied staff, and then meeting new friends.
New friends? Look around. You might just meet your new best friend.
Yes, making friends too, yes.
Long-term friends.
Yeah.
This is my second TravCon. I plan to go to everyone until I die. Hopefully I can find my wife here someday.
Maybe a spouse. I wouldn't count on that though. You've got amazing speakers, great networking, new best friends, coffee all day, and don't forget the swag. The booths like to have games and give away some great prizes.
Love TravCon because I get to enter to win Chanel bags, Louis bags, and Gucci bags. Lots of swag options.
Okay, I know you're having fun with your new friends, shooting some hoops, but let's not forget, this is Vegas.
I'm here for a good time, baby, don't stop, don't stop. Take it easy, that's what I'ma do. Take it easy, show you how to move. Take it easy, go and fix your ass. If you're looking for a good time, come and find me. We do it real big.
TravCon 2023 is one you're not going to want to miss. More information at travcon.org.
Early bird tickets are now on sale. Get the lowest price you can get before early bird ends. Tickets are currently $379 and will be going up soon. Thank you, TravCon, for being our sponsor. Don't forget to get your early bird tickets to get the best price you can get. Please welcome TravCon speaker and committee member Dylan Callier.
Hey Nomads, happy to be here talking about allied healthcare in the travel space. I got my notes here. I am well caffeinated and I am in sunny Alaska currently. As my intro was probably talking about, I am still working as a clinician, even though I am on the TravCon committee. I do take travel contracts full time. So currently I am doing home health and have been doing home health for about the past 5 years as a traveling physical therapist. I jumped into the travel space about 6 years ago. A lot has changed since then, especially for us allied travelers. So happy to get into that. I jumped in, started my own podcast with New Medical Nomads, and then that was really my way of tricking people on to answer all these questions that I had about travel that weren't out there because there was no specific niche kind of education out there for travel physical therapy. And that really relates a lot to any of the allied specialty fields. And so I started that, did that for a year, and then finally jumped in to travel healthcare, which is what I had dreamed about doing for probably a decade before then, ever since I had first heard about it. Now pretty well versed in the space. Not only have I learned more about travel therapy, but also travel sonography, travel technologists, travel lab specialists, and kind of knowing the niche details between each. So the big kind of the way I'm going to organize this conversation is I'm going to lump all of us into allied as a big group, and then further on in this session I'll break it down into more specifics. At TravCon, I kind of call it we spread our allied sessions thin because our speakers are really pushed to the max of their knowledge, because we are trying to create an umbrella as large as we can to capture enough professions to really provide enough value for the numbers that we have for the allied side of the conference. We're growing every year. We are currently somewhere between 12 to 13% of the conference, so very excited for that. Again, 6 years ago, there's like 40 of us total. Now there's like over 200, which is very exciting. So you're definitely not alone out there as a allied travel healthcare person. So just realize there is starting to be more niche content out there. So if you can search for that, there's probably somebody out there posting some sort of content. A lot of organizations are starting to change their verbiage and how they market to expand outside of just the travel nursing world in general. Which has also led to me talking to you today. So very happy to be here. Just know that, there's niche content out there. You just got to look for it. There's niche groups out there. You just got to look for them that might be a little bit more specific to you and your specialty. Now, the big overarching takeaway from this session is going to be that 90% of what you need to know, you could read a travel nurse blog, you could listen to a travel nurse podcast. 90% of what you need to know for travel healthcare for your specialty, tax homes, housing, the way the business works, all of that's going to be identical to a travel nurse. That last 10% is going to be more surrounding around your clinical skills, around what orientation looks like, and a big one is going to be the licensure process. That tends to be the biggest difference. So just know, if you are going and listening to a podcast or reading a blog or sitting in on a group conversation and they're saying the terms travel nurse, a lot of that's going to apply to you as well, even though you are a travel therapist or travel rad technologist, or you're in interventional radiology, or you're in the lab. A lot of that is going to be very specific to you as well, other than those three things. And again, those three things are clinical, orientation, and your licensure, specifically for state licensures. So I will start off by talking about us allied as a big group. And then I'll kind of break off into more of the nitty-gritty specifics for each specialty out there. What is different about allied other than those three things? The big difference, talking with recruiters about allied, what you'll notice is that most recruiters, they don't do both nursing and allied. Most of the times they will either do nursing or they will either do allied. Now, on the allied side, they might do therapy, radiology, lab, all of it. Or they might be pretty specific to only therapy. But rarely do you have one that does both. And a big portion of that is the knowledge that comes along with learning the travel nursing side of things and learning the travel allied side of things. It's hard to know everything. So oftentimes they kind of niche down into either travel nursing or travel allied. Another big part of it, though, is the culture behind each. And if you ask a recruiter this, especially ones that have kind of switched over from maybe travel nursing to the travel allied side, they notice a big difference between talking to a travel nurse versus a travel therapist, travel lab specialist, travel sonographer. That culture is going to be that usually allied individuals tend to have a stronger affinity towards using the same recruiter. They tend to be relationship focused. And so it's not uncommon for a travel allied professional to have the same 2 to 3 recruiters throughout their entire travel career. Typically, travel careers last somewhere between 2 to 3 years. That's typically when people start really craving community and start like settling down. Maybe they meet somebody. Maybe they're a travel couple and they found the city that feels like home, sort of thing. But it's not uncommon for them to have the same recruiter to 2 to 3 recruiters that we recommend throughout their entire travel career. Travel nurses tend to bounce around a lot more. Now, that might be partly just because of the competitiveness, but also I think there's just a lot more travel companies out there that target travel nurses, and so there's more options. So I don't necessarily think it is all just on the travel nurses for, having a one and done contract with this recruiter and then coming over here and then going over to that company. They do tend to be a little bit more money focused, I would say, in my experience. However, I think a lot of it is just the marketing. There's a lot more marketing to travel nurses, so there's a lot more options readily available to you as a travel nurse versus travel allied. It used to be, especially about 4 or 5 years ago, there were really only a handful of specific companies that dealt with travel allied. Then about 3 years ago, there was a big report that came out that travel allied had, increased by 20% or something like that. So money was talking. A lot of these travel companies started jumping into the travel allied space. So now there are a lot more of our of opportunities out there for us as travel allied healthcare people. And as that becomes more readily available to us, we might start looking more like the travel nurses, where maybe we're not as relationship focused. But as of now, travel allied tend to be more relationship focused. So the general vibe of recruiters is a little bit different, where they're more likely to call and keep up with you. I still have recruiters that I haven't even taken a job with, but I consider them friends. And we tend to stay in touch. We do a lot of adventures. They tend to live vicariously through us. They want to see pictures of the hikes. They want to see, pictures of your international travels in between contracts, those types of things. So definitely treat your recruiter as an invaluable partnership, especially in the travel allied space, because it is a much smaller circle. But also that's how you become a great traveler, and that's how you become on the top of their list when you're looking for that one special San Diego job that everybody wants, and you're the first person that comes to mind for them when it pops up. So that's a big piece of the differences between travel allied and travel nursing. And going back to that piece where it's just a lot to know for these recruiters that are coming in. Most of them are not from a healthcare background. So when that 3 years ago, that big study came out and showed that, travel allied is in fact very lucrative for these companies. The year later, all these companies that had not dealt with travel allied before were all saying that, oh, we're staffing travel allied people now. So if you are finding yourself at, say, TravCon and talking to these booths, or you're getting a random phone call from a staffing agency, a big question to ask is how long have they been staffing allied, and how long have they been staffing specifically your specialty? Because there's a big difference from a company that's been doing it for 25 years to a company that has been doing it 5 years, to a company that is, we actually just staffed our first person 2 weeks ago. And you'll be surprised at how often you hear that. And it's okay to work with those companies. You just want to make sure that you're aware of that, because there's more risk of other things popping up that they just don't realize is special to travel allied. But also, you want to have at least one company that's been doing this for a while on your side so that you can learn, especially if you're a new traveler jumping into this, because there's not as much niche content out there for us. A lot of these very veteran recruiters that have been in the game for, over 10 years, they're going to be a huge resource for you and throughout your travel career. So at least have one company that's been doing it for a while. I would say more than 5 years. And you'll be well taken care of if you can add a company like that to your roster. So breaking down with the allied groups, specifically talking about clinical orientation and licensure. When I talk about clinical and your knowledge for specific information regarding your day-to-day, a large portion of that, especially on your interview, is going to be, what the productivity expectations are, what are appropriate productivity expectations, or ratios, if that's what your specialty uses. Know that before going in. For example, with travel therapy, we can kind of jump around between contracts or between settings pretty easily. There's usually not a 2-year wait associated with that. So knowing that you want to do your homework before you accept a job like that, because you might be walking in to a SNF that is just god awful, or a home health agency, or a hospital that's just going to run you over with patients, or an outpatient that's a notorious mill, but you're not going to know that unless you know the numbers and the appropriate expectations for productivity. At least on the home health side of things, we're starting to see companies really push towards 7 patients in a day, treatment-wise. With the amount of acuity that these patients have coming out of the hospital, I personally think that is not doable in an 8-hour day, and we are paid per hour. So that does help, since now we are hourly, paid hourly by the hospital or by the home health agency or whoever it is that we're working for. Because of that, we have a lot of leverage versus a staff clinician who maybe is just waiting after work, doing an hour-and-a-half documentation every day, but it's not billable time, so they are not getting paid for that hour. That is considered work for us, so we have a lot of leverage when it comes to that. So that is one of the benefits of being a traveler. But definitely do your homework before you just jump into a new setting, and that includes knowing your productivity or your ratios and what's an appropriate amount. That way you're not getting yourself into a big mess. For the rest of Allied, know your scope. Be comfortable saying no, not only to the amount of productivity that you might be kind of incentivized to complete, but also we tend to get asked to maybe sign notes of a previous traveler that was there. We might be asked to maybe do things that are kind of in the gray area of our scope. If you run into this, just know that most agencies have a clinical liaison that you can talk to and ask these questions. Also talking with a veteran traveler or a veteran just clinician in general, they can usually help be a guide. But as a traveler, we tend to have more risks than staff, but that's just part of the agreement. We get more benefits, but we have to accept those risks as well. So have some people in your back pocket that you can call if something were to pop up that you can ask. The companies do have a clinical liaison usually. However, typically they're going to be a nurse, an experienced nurse, or a nurse practitioner, so they might not understand your scope as well. And just having your own person to call is pretty nice too, because there are some incentives on the liaison end to kind of keep you at that facility per what the staffing agency wants. So just follow the incentives, but also be comfortable with saying no, especially as you get really comfortable as a traveler, knowing what your productivity is. And the more contracts you do, the more confidence you're going to gain. And you'll be able to tell for those contracts that are just trying to run you over. And you can stand your ground and just be like, hey, I've never had problems before. I've been doing this for X amount of years. If there's any issues, I'd love to resolve them. But for productivity or me working, what you're asking is for me to work in overtime. We might need to talk with my agency or talk with my recruiter, kind of put it on them. Typically, things that you run into can be resolved. I kind of look at it as a triangle. You got you, the clinician, your recruiter / agency / account manager, and then you have the hospital representative here. And oftentimes you can take care of things within house. I've found as long as you're professional and polite but firm, I've rarely had any issues that have resolved to escalation to where I was worried about that contract getting canceled because of it. Moving on to orientation. Orientation tends to be pretty different from nursing. And I think a big reason of that is that hospitals tend to have the science down of onboarding, especially for travelers. When us as Allied are going in, it's not as repeated, I'll say. They don't have it nailed down. It's not a science yet. So typically we get a little bit more time for that orientation. Now, that being said, we still do have those jobs where it's just you sign the HIPAA form on the first day and boom, you're straight to treating. So be ready for that. But in my experience, in talking with more Allied travelers, typically we get longer than a day or a day and a half of ramp up. Depending on your niche specialty, that might be very different. Depending on the need of the hospital, you might be incentivized to jump in quicker than what they typically had. If you've been doing this for a while, you might be like, oh, I just want to treat patients. I don't want to watch any more of these modules than I need to, and that is very okay. So just know that our orientation tends to be longer than what a nurse would see, but we do have quick starts. So definitely be ready to go when you show up to save the day for this company that you'll be working for. Licensure. So this is probably the biggest difference between all the Allied travelers, but especially for nursing. Nursing has a very large compact that covers a large portion of the U.S., so they really don't have to have individual state licensures. Therapies, we have to have individual state licensures. Radiology, for you technologists, I believe, and sonographers, you don't have state-specific licenses, but more of a national license. And it's very confusing. That's why I say have somebody that has been doing this for at least 5 years for you guys, because it is very different. I've been taught multiple times and I still don't quite understand it. So definitely have somebody who's been doing this for a while in order to have your bases covered, so you know the appropriate expectations when you're trying to go to, say, Washington. That would be a very different licensure process than, say, Florida. For therapists, we are slowly getting our own compacts. PT, most of the states are now on, majority above 25. OTs, you are, I believe, enacted. If not, you're very close. And then SLPs, you're starting to get a compact licensure as well as for those travel audiologists. So we are getting our own compacts. It is very nice when you're able to take advantage of it. Just know the rules, know where your home license needs to be in order to take advantage of those. It's not just cut and dry. You do have to have some knowledge of like what those rules are in order to take advantage of that privilege. It's not a compact license, it's a compact privilege is what they say. And the difference is that you do need a home license in a state that is participating, and that home license needs to be your tax home as well. Just some last points for Allied Total that I thought would be important to talk about. Housing has become incredibly hard in the past year and a half. As far as I'm aware, there hasn't been another time where, you're looking at a contract, you're excited about this job, and then you've had to cancel that contract because you can't find any housing. We would typically run into that if you're trying to work in a rural area, but it's never been like that for a city before. And now these prices are just getting very hard and ridiculous to actually afford to go to some of these areas. So in addition to that, be selective on who you tell that you're a travel healthcare person. If you're using an app that is specific to travel healthcare, it's kind of assumed that you are in travel healthcare. But if you're going through somewhere like Airbnb, some of these larger companies, maybe you're in a Facebook group and you're finding housing that way, be selective on who you tell that you're travel healthcare, because all of a sudden they associate you with a travel nurse and they think you're making these astronomical big bucks, even though that's coming down for the nursing market now. So that's no longer the case. But be aware that some owners out there are going to assume that you're earning the same as travel nurse, and they might try to either raise the rate that you're paying, which is ridiculous, or it's going to limit your negotiating power because they assume that you're earning more, and they assume that you can afford more that might be typically reasonable. It used to be that I never had to pay more than $800 to live somewhere. Now that's gone up to about $1,500 is what I'm expecting if I want a place to myself as a solo traveler without any pets. So it's getting harder out there. Be selective on who you tell that you're in travel healthcare. I used to tell people to do it all the time because, you're not a construction worker. I'm not worried about beer cans in my parking lot. I'm not worried about holes in my wall when you leave. Those types of things. And we tend to be more professional and, not unpassing drug tests, for example, because we get tested so often, and we're a pretty safe group to have and rent out properties to. But now we are starting to see some pushback and some cons related to just upfront telling the homeowner that you are within travel healthcare. If you do, just make sure you make it a point that you're not a travel nurse and you're not earning those big bucks. And that way you retain some of that negotiating power that you otherwise might lose. Just in general that I wanted to talk about with travel healthcare, because you have a staffing agency behind you, if you find yourself in a room that a patient has now sued the hospital, there's a good chance that you're going to end up on that list because travelers are associated with staffing agencies. Staffing agencies are associated with having deep pockets. So what I tell any clinician, but also Allied, just because it's usually more affordable for us, that you want your own professional liability insurance. The hospital usually has their own. The staffing agency usually has their own. but those liability insurances are for the benefit of the company, not necessarily the employee. Usually those line up, but not always. So always have your own professional liability insurance. The gold standards are the 3-in-1, which means a $3 million aggregate. So that's a total amount. And then they cover up to $1 million per incident. It just gives you peace of mind. So I highly recommend that, especially for us Allied. It's usually fairly cheap. If you're not sure where to go for those, usually your national organization will have a preferred partner, and usually there's a discount associated with that. Know that the more specialized you get with your specialty, so I'm thinking if you're in interventional radiology, for example, or if you are a hand therapist, for example, the more specific you become, typically the more you'll earn, because those jobs will pay more. And as you get more experience, you'll be a more competitive candidate to where you'll be the successful applicant to get that job. So you do tend to earn more doing that. However, you'll just have to be more flexible because those jobs are more rare. So instead of having, say, 600 jobs for you to choose from, might be all the way down to like 40 jobs to choose from, and then you'll be traveling pretty consistently through the states, unless it's like California. Usually there's always some California jobs. When in doubt, get your California license first. That's usually where the jobs are. But if you're ever curious, most companies have some sort of top states to apply to. So just ask them, like, where are you seeing the most jobs at? And then they can tell you, here are the top 3, and maybe look at getting your first licensures for. All right, so going to start breaking down the Allied group into the more specific niche groups. So therapies, we tend to have more rural jobs than compared to nursing, pretty much because we don't only work in hospitals. Also, if you think about us as therapists and be more active, more likely to be the hikers, the outdoorsy people, Colorado jobs are really hard to come by, and Utah jobs are really hard to come by. Alaska jobs are hard to come by. Because of that active component of it. Because we're not working at hospitals, maybe we're working at outpatients or home health agencies or skilled nursing facilities, you'll see a lot more rural jobs out there than what nursing does. Nursing tends to be in somewhere with at least a population of 10,000 or the bigger cities. So just know that sometimes those jobs can be really, really good. There's always a reason they're looking to fill a position, and it's either, bad management scaring people away. Maybe they're just not paying people enough, or the job's really hard. It's one of those outpatient mills, or maybe it's just in the middle of Kansas and it's a great job and they're paying great, but they just can't hold anybody down in that rural Kansas area. So sometimes those can be a really good way to break up a really hard contract with somewhere kind of easy peasy in the middle, and then go for one of those harder contracts that might be closer to a city that you want to visit. Respiratory therapy, because you're almost always associated with hospital jobs, you're going to look very similar to nursing for those orientation, and then also for years of experience needed. Therapies, we get to jump in as new grads. A lot of that's not necessarily because we have more clinical hours during our school year curriculum, but it's more because these giant hospital systems have to be more conservative with how they hire people. So respiratory therapy, you're probably going to need 2 years before you jump into travel. That has kind of changed with the healthcare needs of the past couple of years, but we're starting to level out a little bit more. So I would anticipate, if you're in school right now, anticipate working a full 2 years before trying to jump in. If you are a therapist that is trying to work at hospitals, probably going to need 2 years experience as well. But if you're an outpatient or you're trying to jump into home health or you're wanting to jump into SNF, rarely do you have any sort of yearly requirements, and usually they'll be willing to at least train you a little bit on how to operate within that setting. Therapists, we get to travel as new grads. A big question when I started traveling, I started jumping in about 10 to 12 months out of school. So still within that new grad status, barely. Should we travel as new grads? And my favorite way to answer this is, there was a big post in a big Facebook group, and it said, how was your training when you first came out of school? And the options were like, couldn't have done it without my clinical mentorship. It was fine. And then like the last one in the overwhelming majority is, what training? I've gotten more training in my years as a travel therapist. I got more training in that first travel contract than I did my entire first year working in that first job outside of school. A lot of our universities really push back against travel, or at least they used to. Now that there's more information and education out there, I think they realize it's not as scary as what they assumed. But a lot of the universities will push these clinical mills where you're seeing 100 plus visits a week. Yet they say that, travel is the boogeyman over here, when they're pushing the worst jobs. Their partners that they coming and talking, sometimes are the worst jobs out there. So yes, just because you are a permanent staff person doesn't mean you're going to be receiving that clinical mentorship. If that's something you really care about, I would say make sure it's in a contract, because they're going to say that as a buzz term to get you committed, but oftentimes you're not going to receive it. So if I was a new grad looking to jump in and the market was well enough for that, where I didn't feel I had to sacrifice, being in a safe spot, I would choose a contract that I could do for a full year. And I would just jump in it like that, and just be very upfront that this is your first, out of school, that you would like some training. Again, we tend to get more clinical hours during our education than any others. So that would be okay to do. And everybody has to learn somewhere, whether you're a staff perm person or whether you're a traveler. Just be aware that if you do jump into travel, you might find yourself at a job that is having you sign the HIPAA form and jump right into work. And it's a little bit more risky to do that as a new grad or as your first job versus waiting a couple of years to get your clinical pattern recognition down. For speech language pathologists, for your CF years, highly, highly, highly recommend just focusing on yourself, doing the CFY while you're at the hospital of your choice. Don't worry about travel that first year. There are CF positions where you can get the travel job for that, but typically you're the only SLP when you show up. They're really hurting for people. It's going to be one of those where you're really incentivized to hit the ground running. So really just take care of yourself that first year, and then you can jump in. You can wait 1 year. Talk to some travel speech therapists out there. Most of them agree with that. There's always some people that have taken advantage of it and done it, and usually they work out fine. But I think it's just, there's going to be a lot of stress, and I think it would just be better just to hold off for 1 year. Travel assistants, you are the true travelers of healthcare. Very competitive. When pre-pandemic levels, usually we were seeing around 10 occupational therapist assistant jobs at any time, and physical therapy assistants were around 40. When COVID hit, those went to 0. You have the most competitive market, so you have to be ready to be very flexible if you're wanting to travel. And that's kind of the cost to entry, is that you're going to have to be willing to flex between settings. You're going to have to be willing to flex between states, and just be very flexible, and you'll be successful. There's plenty of travel PTAs and travel codas out there that are successful, but it's all in the flexibility. Be a good traveler if you're an assistant. That means submitting to jobs fast and getting your paperwork done fast. And that will help you get those jobs. My tip for trying to get a job is if when they call you for the interview, it's always at a bad time. You're always in a truck with like 3 people you haven't met before, and you're like going to brunch with your friend. And if you can even just answer the phone and be like, hey, I am not in a very good spot right now. It's pretty noisy. Can I call you back in like 10 or 15 minutes? They'll usually say yes. And then you can call them back and have that interview, because as soon as they find the traveler, they're going to stop calling people because they're very busy. They have other stuff to do. So know that if you miss that interview, you need to be calling them back fast because they're already talking to somebody else. If you are giving a range of times for the interview, you're going to want to ask for the earliest. So if they're like, what time works for you tomorrow between 10 a.m. and 2 p.m., you want the 10 a.m. slot, because if you don't take that, somebody else is going to take it. And again, they're going to stop interviews once they find the person. So those are my big tips. And that's what I did as a new grad when I was getting ready for these jobs. I knew that my resume wouldn't be as competitive as some of the others, and that just meant I had to be faster. And so that's my big tip to anybody with competitive markets. This for sure covers the assistants. Also, anybody in radiology, you guys tend to have a harder market, and clinical lab specialists, you tend to have a harder market as well. So all those tips would apply to you to get your paperwork done fast, submit to a job fast, and be quick to get the interview. If they give you a range, choose that earliest time. Just a kind of an overall tip for therapies. Because of the nursing shortage, we're being asked to do a lot more than what we had been asked for in the past. Specifically, for an example, would be home health. 5 years ago, it was pretty rare for a therapist to do an admit in home health, which is basically like a hospital admission. You have all this paperwork. Now we're being asked to do more data collection with medications. We're being asked to do more like light wound care for physical therapists. A lot of that, just make sure that you're actually trained in that. And that's not just saying that you picked it up from a coworker. Say that you are seeing a patient who's a diabetic. There's not a nurse available. You take on that patient. You do everything correctly education-wise, but they still end up, something goes wrong with the insulin. If you can't show on a calendar that you were trained to work with diabetic patients, or to work with pressure ulcers and it got infected, or to that a nurse didn't look at the medication list for education, that can be a scary place to be, even if you did everything right. So make sure that if you're going to start doing some of these more, I call it like wearing the nursing hat. If you're going to wear more of a nursing hat, if you're going to wear more of a social worker hat for connecting stuff, make sure that you have somewhere on the calendar you can point and be like, I was trained on this day with this company in order to do it. That way that you have yourself covered for a liability issue if something were to go wrong. Jumping to radiology and sonographers, again, your licensure is typically a lot different than most of the other allied and most of the other travel nursing. So I would say at least have one recruiter on your team that has been doing it for over 5 years. They can help with knowing the timeline for things, knowing which licenses you need to work where. That would be my big tip for you, as well as especially if you're in interventional radiology. Your jobs are going to be more competitive, and the more specialized you get as a sonographer, it'll get more competitive. But again, just because you're in a specialty vascular doesn't necessarily mean you have to take a vascular specific job. You always have the other options as well below that. But just know if you're wanting to take those more specialized type jobs, you're going to have to be more flexible in order to get those. Be fast and take the first interview option that you have. For my clinical lab persons, you, for some reason, tend to have the most thorough interview processes. So not only is your job pretty competitive, but don't be surprised to have, a 30 to 40 minute interview where they're asking you questions. It's very different for travel. A lot of times we think of interviews as a permanent person, as a staffing as just a typical job where you're gonna potentially work there for 5 years. Usually the employer is asking us a lot of questions. In travel, they are so desperate that they rarely ask questions other than what's your start date and do you need any time off. But for lab, you guys seem to be the exception. So be ready for more of a lengthy interview. Now that we're getting more comfortable with video calls, be ready for a video interview. It's hard to take interviews rolling out of bed anymore. You used to be able to just, kind of throw on some sweatpants and do the phone interview, but now kind of have to look more presentable if you're going to do a video call. But just be ready for that. I would say that's a big difference for clinical lab versus any other travel specialty out there. And just realize that you guys tend to be competitive as well. So those questions are going to matter, as well as your follow-up questions. That is also a way to show that you are very familiar with your field, and they tend to feel a lot more comfortable with somebody who is asking questions versus somebody who doesn't have any questions in reserve for how their operations go. But all that is my big surface level tips for allied and allied travel healthcare. Again, the overarching thing is that 90% of what you need to know is going to be, you could lump it in with travel nursing, whether it's finding housing, tax homes, how the business works. If you're reading a blog and it has travel nurse in there, you could easily put travel allied, and most of the times it's going to be very similar for that 90%. That extra 10% is where you're going to flourish. That's going to be your clinical knowledge, how to expect what's going to happen during orientation, and then knowing your licensure. So there's a lot more information out there. I call this the information age of travel healthcare, because you just need to search and find the blogs and find the podcasts, but there's the information out there. And then you have the options like online for the travel communities, as well as meeting in person at TravCon, that you can get to meet others within your specific niche of a travel allied specialty. And that's where the real friendships and the real family starts. And that's when you get really knowledgeable on how jobs look, because if it's just you have your experiences, but if it is you and your friends, you all get to collectively share those experiences and learn faster. All right, guys, thanks so much. Everybody have safe travels, and catch you soon.
Thank you for watching the Gypsy Nurses Spring 2023 virtual conference sponsored by TravCon. You can watch this session again, or others you may have missed or would like to watch again, on thegypsynurse.com under the Events tab and by clicking On Demand. Thank you, TravCon, for being our sponsor. Don't forget to get your early bird tickets to get the best price you can get.